of your nurse today. I'm just coming to do a head to toe assessment, okay?
Okay.
If you have any questions or anything throughout the process, just let me know.
Okay.
But I'll walk you through as we get there, okay? Can you verify your name and date of birth, please?
Megan Corbin.
Okay. Your date of birth?
9/26/86.
Good. I'm gonna hand hygiene. Okay. Megan, do you have any allergies that you know of?
No.
No? Okay. Any pain today?
No.
No? Good. Again, I'm gonna do a head to toe assessment. I'm gonna look over everything. It's a little extensive, but be patient with me, okay?
Okay.
Anything that's uncomfortable or anything, just let me know.
Okay.
What brings you in today?
I was in an accident.
An accident?
Yeah.
Well, that's no good.
Yeah.
You said you're not feeling any pain?
Not anymore.
Okay, well, good. Do you know where you are?
The hospital?
Hospital, good. Do you know what year it is?
2025.
Okay. Patient is alert and oriented ×4 to person, place, time, and situation. Body position is relaxed. Facial expressions relaxed. Patient speaking clearly. Is responding to my questions well. Doesn't seem to be any hearing deficits. Clothes and skin appear clean, put together. Did you eat breakfast this morning?
I did.
Yeah, and what have you been drinking? Lots of water?
I do.
Okay, good. So nutritional status is good. Mood looks good. Okay, so I'm just gonna go ahead and get some vitals, okay?
Okay. Do I need to remove my jacket?
Yeah, let's go ahead.
Okay.
It doesn't look super thick, but it'll make it easier. Do you have an arm preference that you'd like me to use?
No, I don't.
Okay, no IVs or anything like that. Good. Okay. We're gonna go ahead, do your blood pressure. I know, it's all tangled up here. It's gonna be a little tight, okay?
Okay.
Should only be uncomfortable for a minute.
Okay.
Cross your legs for me. Okay, blood pressure is 122/82, so pretty good. Don't suffer from any white coat syndrome, huh?
Nah.
Good. Okay, the next thing I'm going to do is I'm going to go ahead and get your O2 sat, okay? Okay, O2 is 98%, that's great. Now I'm going to check your pulse, okay? So I'm going to have you put it right there. We would normally check for a full minute. Your pulse is 82 beats per minute, and I can tell your respirations have been good. Again, you normally check those for a minute, and you did 18 breaths, okay? Let's see, and then just stick this under your tongue, close your mouth. Okay. Okay, temp is 97.3, it's great. Again, you mentioned no pain or anything like that. Good. And then, the last time you went to the doctor, how tall and how much did you weigh?
I'm about 5'9" and 220.
Okay, good. Okay. Clip on. Okay, so now I'm going to start your assessment, okay? I'm going to start from the top and work my way down to the bottom.
Okay.
First thing I'm going to look is I'm going to inspect your scalp. Okay, no redness, no flaking, no evidence of bugs, hair looks good, no bald spots. I'm going to palpate, okay? If anything brings you some pain or discomfort, just let me know. Okay, no lesions, no masses, no bumps, everything okay? Okay. The next thing I'm going to do is I'm going to look at your ears. Okay, no redness, no rashes, looks symmetrical. No discharge, no blockage. Anything hurt?
No.
Awesome. There's piercing on that left ear. Go over here. Same thing. Looking. No redness. Looks symmetrical. No obstruction. No abnormal drainage. Piercing on the right side as well. Did anything hurt when I was pressing on it?
No.
Good. Okay. The next thing I'm going to do while we're doing your ears is we're going to do a whisper test, okay? I'm going to stand behind you. You're going to cover that opposite ear. I'm going to whisper 3 words to you, and you just repeat them out for me, okay?
Okay. Blue, red, yellow.
Okay. The right ear, past the hearing. Same thing.
Mermaids are real.
Okay. The hearing on the left ear is good. Now I'm going to go ahead and look over your eyes and your face and all that, okay? I'm going to apply some pressure. I'm going to go ahead and take your glasses off though.
Okay.
I'm going to set them right there, okay?
Okay.
I'm going to apply some pressure here to your frontal sinus. Do you feel any pain or discomfort?
No.
Okay. No abnormal fluid buildup, I can tell. What about here?
No.
Good. I'm going to look over your eyes. Eyelids look good. Eyelashes are good. No crusting, no redness. Eyes are symmetrical. So it's nose and facial features. I'm going to go ahead and do a couple of different vision tests, okay? The first one's going to be your peripheral. It's going to start behind you. As soon as you see the pen, just let me know, okay?
See it.
Okay.
See it.
Okay. Peripheral vision is good. I'm going to have you focus on this pole out here in the distance, and I'm just going to shine this light in your eyes, okay? I'm just looking to see if your pupils react accordingly, okay?
Okay.
Pupils reacted according to light. The next thing I'm going to have you do is I want you to focus on my pen, and then I'm going to move it closer to you, okay? And I just want you to keep focusing on it. Okay. Pupils reacted to accommodation. Now I want you to, just with your eyes, no head or anything like that, just follow the tip of my pen, okay?
Can I put my glasses back on?
You know what? Let's go ahead and do that.
Thank you. Oh.
Yeah, maybe could have done that with your glasses on.
It's okay.
Okay. Look up. Okay. Your cardinal fields of gaze were good. Okay, so now I'm going to look under your nose, okay? No obstructions. Can you go ahead and place a finger on one side? Okay, not the other. Okay, deviated septums noted. Go ahead and open your mouth and stick out your tongue for me. A little bit more than that, Miss Corbin. I gotta check all in there. Okay, because it's pink and moist, no whiteness noted on the tongue. Teeth are intact, piercing on the tongue. Okay, now we're gonna check your neck. Okay, I'm gonna feel here. I'm just checking your lymph nodes. Any tenderness?
No.
Okay, they don't feel swollen or anything like that, so everything's good. Just gonna inspect your neck. Okay, everything's good. I'm gonna assess your carotid pulse on one side. Okay, assess on this side. Good. Wrist bilaterally. No noting of jugular vein distension at the 45 on the left side. Go over here. Okay, no noting of jugular vein distension on the right side. I am going to go ahead and raise that up to 90 degree angle and recess. Okay, I'm reassessing the jugular vein distension. Nothing noted on that side. And again, nothing noted here. Okay, now I just want to make sure your neck isn't feeling too stiff or anything like that. So look all the way up for me. Okay, all the way down, all the way to the left side, all the way to the right, Okay, any pain or stiffness or anything like that?
No.
Okay. I'm gonna place my hand on your side. I just want you to push against my hand, okay? Good there. Okay. Neck strength is good, appropriate for age. Now I'm gonna apply some pressure and I want you to shrug against me. Okay, good, nice and strong. Okay, I'm gonna go ahead and lower you down a little bit, okay? I'm gonna assess your lung and heart sounds and all that kind of stuff. I'm gonna start, actually, you know what? I'm gonna have you sit up a little bit. We'll go ahead and do your back first so you can go ahead and lay down.
Okay.
Okay, so normally we would remove the shirt or gown. I'm gonna inspect. No redness, no rashes, no bumps. Patient appears to be using chest equally on both sides. I don't see any particular side weakness. Now I'm gonna palpate. Okay, no tenderness noted. Good. No lumps, masses. Okay, I'm going to assess your lung sounds, okay?
Okay.
Bear with me. There are 18 of these. It's gonna take me a minute, okay?
Okay.
Okay, you can go ahead and lay back, Ms. Corbin. Lung sounds were good, clear, equal rate and rhythm. I didn't hear any abnormal sounds, no wheezing, anything like that. Have you had a cough or anything in the past 2 months?
No.
Good. Okay, I didn't hear anything that would indicate that, but just wanted to make sure. Now I'm going to assess your chest, okay? I'm gonna look first and then palpate. Again, any discomfort, just let me know.
Okay.
Okay, I would normally remove the shirt or gown, look over for redness, any bumps, any abnormal masses, if you see anything. I'm gonna go ahead and press, okay? Apply some pressure around here on your clavicle. Any discomfort?
No.
Okay, good. I don't notice any masses. I am going to assess your lung sounds like I just did on your back, okay?
Okay.
There's 10 of these, so not as many, okay?
Okay.
Okay, again, lungs sound good and clear. No labored breathing that I noticed. You're not using any of your accessory muscles. No wheezing. I'm going to check your heart now, okay? And there's going to be 5 places here. So your aortic. Okay, your pulmonic. Herb's point. Tricuspid. And then your mitral. And you'll normally listen here for a full minute. Okay. Everything sounded good. S1 and S2 were noted. No abnormal sounds, no whooshing or anything like that. No heart murmurs. I'm gonna lower you down just a little bit because I'm gonna have you roll over to me, and I'm just gonna check your PMI, okay?
Okay.
Okay. Okay. I'm just going to feel and palpate here just so I can feel your strong pulse. We would normally do this for a minute. Okay. Pulse is strong. Normal rate and rhythm. Okay, you can go ahead and lay back down if you want. I'm going to raise it up. You're more than welcome to sit like that for a little bit longer. Get you nice and relaxed.
That's
So you were in an
comfortable.
accident, huh?
I was.
Was it your fault or someone else's?
No. That's someone else's. My husband was driving, not paying attention.
Oh, those husbands.
Yeah.
Okay. I'm gonna have you go ahead and roll back on your back. I'm gonna assess your abdomen, okay?
Okay. Oh.
Again, we would normally remove the shirt. I would look for redness, any distension, any masses. I don't see anything. I'm going to go ahead and listen for your bowel sounds. Okay. Bowel sounds were active in all 4 quadrants. I'm going to go ahead and apply a little pressure, okay? Let me know if anything is uncomfortable or if it hurts. Any tenderness?
Nope.
No? Good. How was your last bowel movement?
It was good. It was this morning.
Okay.
It's about normal.
Normal color, brown, soft, hard.
Soft. Yeah,
Good.
soft.
Making sure to drink lots of water.
Yes.
And then when you urinated last?
It's just right before you got in here.
Okay. Would you say light yellow, dark yellow?
Yellow, light.
Any abnormal smell?
No.
Did it burn or anything?
No.
Good. Okay. I'm going to check your extremities. Skin color is appropriate for ethnicity. Noted lots of freckles. Hair looks good. No abnormal rashes or abrasions. I'm going to check your capillary refill. Okay, capillary refill is under 3 seconds. Let's check this one. Okay, under 3 seconds there. Same thing, hair looks good, freckles, appropriate skin color. Skin is warm and intact. Okay, now I'm going to have you grab onto both my fingers and squeeze as hard as you can. Oh, that's so good. Strength is good, appropriate for age. And now I'm going to check your radial pulses. You would normally do this for a minute. Pulse are equal bilaterally, 2+. Okay, I'm going to go down to your lower legs. I'm going to check your pulse here, pop the heel behind your knees. Again, equal bilaterally, 2+. I'm going to go down here to your ankles, your posterior tibialis. Again, 2+ bilaterally. I'm going to go ahead and check over the skin real quick. No signs of edema. Skin is intact. No discoloration. Hair growth is still there. Good. I'm going to check your pulses on top of your feet, your dorsalis pedis. Okay, equal bilaterally, 2+. I'm going to apply some pressure on the top of your feet. I just want you to resist. There you go. Feet and leg strength was equal for age. I'm going to go ahead and remove the socks. I would do your capillary refill. Okay, under 3 seconds. Okay, under 3 seconds, good. I'm looking in between your toes. No signs of redness, itchy, flakiness. Have they itched recently or anything?
No.
Good, you're making sure to change your socks frequently, keep them dry?
Yes.
Awesome. Okay. Next I'm gonna have you hop on out of bed. I'm gonna have you stand over there for me. And then I just want you to walk back on over here to me. Okay, now turn around. Again. Okay, gait is good. No motility devices needed. Okay, so I'm gonna have you come and stand right on over here. We're gonna do some range of motion tests, okay? And so just copy me. Okay? You're gonna put your arms out. You gotta put them over. Okay. Let's do. Yeah, there you go. Okay. And then just move your arms in a circle. Okay. Awesome. Your upper extremities, range of motion is good. No stiffness. Nothing hurts.
No.
Cool. Okay. So now we're gonna do your legs. I'm just gonna have you pull one out in front, put one in back, to the side. Okay. And, oh wow, you've been going further than me. I would be falling over.
Mm-hmm.
I'm gonna have you flex your foot downward, up, and then roll it. Cool. And then the opposite foot. Okay. And then on this leg here, go ahead and do it front, back, And to the side. Awesome. Okay, you can go ahead and get in bed, Miss Corbin. Looks like you turned out pretty lucky. I can't see anything to be too concerned about with that accident. Do you have any questions? Anything that you're concerned about?
No.
No? Good. Okay. Well, we covered your head and your arms, your stomach, your heart, your lungs. Everything looked really good. Nothing to be concerned about. The provider will be in though to check with you. You're in a good position. Your rails are up. Do you want me to lower the bed in case you would like to lay down?
No, I'm okay.
Okay. I am your call light. I'm gonna put your call light here just in case. We're gonna pretend this is your call light, okay?
Okay.
If you need it or if you're feeling sick or anything like that, just hit your call light.
Okay.
Other than that, the provider will be in soon with you, okay?
Okay.
Gonna get rid of my gloves. Gonna wash my hands and I'm gonna document.